So you asked, why is it that some children who've had adverse childhood experiences and early life trauma are aggressive? Why is it that sometimes they'll hit out at others, they might throw items or break items, or even hurt you? So a lot of this really does come down to those early life experiences. It's what they've seen, it's what they've heard, and it's the impact those experiences have had on their development. So let's think about this. Children who've had adverse childhood experiences have often grown up in environments where there is lots of hitting, there is lots of shouting, and the adults around them don't really know how to resolve conflicts themselves. So why are we surprised when children model that behaviour and they become aggressive themselves, hitting and shouting to try and resolve conflicts? But, and here's the big thing, there are further impacts from adverse childhood experiences too that we always have to remember. As children, our internal regulation system develops from us modelling adults. So we learn how to calm, we learn how to soothe ourselves through modelling those around us. Children who've had adverse childhood experiences have often missed out on that appropriate modelling. So then their regulation system doesn't form properly and they can't regulate when they need to. This really contributes to that increase in aggression and that response where they go from 0 to 100 in a few seconds flat. The third thing that really contributes is that children who've had these adverse childhood experiences often really don't know what to do when things don't go quite right. It really is that they don't know how to respond. So they're searching around for anything that can help them, and often they pick a maladaptive choice so they can be aggressive or throw items when they really don't want to, but it's the only option they have because they know nothing else to do. We need to think of it in terms of they actually don't know what to do. They have no better solution. If they did, they'd be using it. The fourth reason a child may be aggressive and may continue to be aggressive is in that some way in the past that has actually worked for them. It's achieved the outcome that they needed at the time, and that could be just getting their needs met. So as adults, if we really understand these things, we can help children to be less aggressive and overcome those adverse childhood experiences. Keep swiping and follow us for more information on adverse childhood experiences and childhood trauma.